Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. We're going to be speaking with Victoria Ventura. She's a wife and a mother, and she's joining us on the program to talk about her diagnosis and treatment journey with a very serious and often underdiagnosed condition of coronary microvascular dysfunction, or CMD. Welcome to Health Professional Radio, Victoria.
Thank you so much for the opportunity to be here with you this morning.
Now, I did, of course, mention that you're a mother, a wife and a mother, but you do realize you have a show business name, right?
That's absolutely right. I wear many hats.
So you've got 4 kids, and I guess you were just doing what you normally do when this diagnosis happened. What can you tell us about how you came to be diagnosed with CMD?
Well, Howard, for 11 years, I suffer with this disease called CMD, which is coronary microvascular dysfunction. I had excruciating pain for 11 years. I saw multiple doctors. I did test after test. And for all those years, I was misdiagnosed. I thought it was all in my head.
What were some of the misdiagnoses that you received? What were they telling you that you had when you actually had CMD?
Some of the diagnoses that I got were, it's all in your head. It's your nerves. There's nothing wrong with you. The symptoms just don't add up. And then there were some other ones like, there was a brain tumor discovered during my testing. I had a partial hysterectomy because I developed a severe anemia. And then just that it was my nerves and that it was all in my head.
So what exactly is CMD?
Well, you know what? CMD is what happens is the small arteries around the heart, they stop working and they stop sending that blood that the muscle around the heart needs. And, with CMD, the small arteries are not blocked. They just, they end up dying little by little. So they don't send that oxygen that the heart needs, that blood that the heart needs. So they stop working.
So we're not talking about a blockage of the artery that causes a heart attack or something. This is something that you dealt with it for 11 years and then some years after your diagnosis. So it's something that isn't easily diagnosed. Do the symptoms, obviously, they don't show up on normal tests, or you would have been diagnosed a lot sooner.
That's correct. It is a very hard to detect disease because normally doctors are trained to test and to look for a blockage in arteries. Well, with CMD, there is no blockage in the arteries, and that's why it is so hard to diagnose, and that's why we're with so many years being misdiagnosed.
So you had never heard of it before your diagnosis. Now, after your diagnosis and these, after the misdiagnoses, how did you come to be properly diagnosed? Were you doing your own research? Did you finally come upon a doctor who was knowledgeable? How did that happen?
Mm-hmm. So I was very blessed that I did my homework. I did my research. After one cardiologist out here where I live, he misdiagnosed me, and he told me that there was nothing wrong with me, that it was not my heart. Even after I had abnormal EKG, I had a murmur in my heart. I that really fired me up to do my research, and I came across Cedars-Sinai, an amazing Dr. Timothy Henry. He's the one that took it a little further. He performed an angiogram, and that's how he was able to diagnose my disease and finally gave me a diagnosis after so many years that I had suffered.
So were there still some major hurdles or setbacks that you had to deal with once you were properly diagnosed and there was a treatment plan formulated?
Yes, there was quite a few. During my diagnosis, there was an ASD that was discovered. So not only were we dealing with CMD, but now we had discovered an ASD, which is a hole in the heart. So after my diagnosis, I had other symptoms that I had to deal with that were starting to show up from the ASD that I had.
Mm-hmm. Now, I understand that you participated in something called the Escape CMD trial. How did you hear about it, and what was the process leading up to your participation?
You know, I heard from the Escape CMD from Dr. Timothy Henry. When I was diagnosed, I was so happy that I finally had gotten a diagnosis. And that happiness was short-lived when I was told at the time that there was no cure, that there was no treatment for this disease, that the only thing that he could do was to make me comfortable, to help me ease, cope with the pain. But there was hope. He told me that his colleague, Dr. Barry Mers, was going to lead a trial, a treatment trial, 6 months from the time I was diagnosed, and that he would refer me to her. He would give her my name, and hoping that I would be a participant, that I would be a good candidate for her for the trial. So that's how I heard from the trial that was being done, which was called Escape CMD. And, it was the best thing. The best decision I could have made was to participate in this clinical trial.
Now, you said that you were told that it was all in your head, that you started to believe for a time that it was all in your head. Now, I do understand that CMD at one time was referred to as something called Syndrome X. Patients were diagnosed just as you were, experiencing anxiety or some type of psychological issue rather than a heart issue. Who does CMD mostly affect? Younger people, older people, men, women? From your understanding, who's affected most by CMD?
Men and women are affected, but what I read is that it affects mostly women. Mm-hmm. And yes, it was very unfortunate that, in the past, I was considered as something in our head that the symptoms of CMD were all in our head. And that's how I felt from one of my cardiologists. He made me feel that way, that it was all in my head, mm-hmm. that I was making it up. Even now I tear up because it just devastated me when you trust a cardiologist, right? That they're going to help you, that they're going to do whatever it takes to give you a proper diagnosis. And this cardiologist that said it was all in my head, it really, really had an impact in my well-being, in my personal life. It's horrible. It's horrible to feel the way I felt that day when I was told that it was all in my head.
Mm-hmm. What would you say to those who may be suffering from CMD unknowingly?
I would tell them that there's finally a treatment that could help them, feel better, that could help them have a better quality of life, and that they no longer have to suffer.
And being an advocate for yourself, you say you did your own research after becoming so disheartened with your diagnosis, that you did your own research and became an advocate for yourself. Is that correct?
That's correct. When I was when I saw the last cardiologist appear in my area, I fired him. I said, "That's it, you're fired." Yeah. And it's okay to fire your doctor, because they're human and they make mistakes. So I had to read about symptoms that I was having. I did my research. I turned to Google, and I went ahead and did my homework. And I became my own advocate. I was not going to settle for less. I knew that there was something wrong. I knew my body better than anyone. And everybody knows their body better than anyone. And I was not going to live like that. I could not continue to live the way I was living. It was not a quality of life. So I knew that I had to stand up and advocate for myself, for my, to get a proper diagnosis, to research, to go out and look for a second opinion or a third or fourth opinion. I was not gonna rest until I knew what was wrong with me, until somebody would give me a diagnosis. And that's what everyone should do.
Well, Victoria, give us a website where we can learn more, if you would.
Yes, the website, it's www.caladrius.com.
And that's spelled CALADRIUS.com.
Correct.
Well, I appreciate you coming on the program this morning, Victoria. It's been a pleasure speaking with you, and I'm glad that you're doing better.
Thank you so much for the opportunity. I appreciate you. Thank you, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Victoria Ventura. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.